We hear a lot of things about the vaccine and some concerns that people have, some myths that are out there being shared on social media, such as the fact that the vaccine, the platform for the vaccine was designed in 2 days. Isn't that too rushed? Well, it's interesting. It really is pretty remarkable how fast the vaccine was developed, but it was more like taking the code, the genetic code, and plucking out a piece of that code that would be used to make the vaccine. So it's more like computer code than making a biologic in a lab, for example. But also the technology that we're talking about for these vaccines, the messenger RNA vaccines, a lot of that research has started decades ago, really, two decades ago, in terms of actually figuring out how to create these new messenger RNA vaccines. So yes, it is fast. Typically these things take years, not months, but a lot of the scientific development around this has been ongoing for some time. Another thing that I hear a lot is if you've had COVID, if you've got it, you don't need the vaccine. There's a couple things to keep in mind there as well. One is that if you've got the natural infection for COVID, you likely did develop antibodies, and that gives you protection. The issue right now is we don't know how long that sort of protection lasts. It could last a long time, but it may not, and we're seeing evidence of reinfection. So that's one reason that you should probably get the vaccine anyway. The second reason is that the vaccine is sort of designed, especially with these two-shot vaccines, to prime the immune system and then to boost it. And the idea, hopefully, is that the type of immunity that you get lasts longer and is stronger from the vaccine than from natural infection. We don't know that for sure yet, but that could be the case. Another thing that we hear a lot about with these genetic vaccines specifically is, could it actually cause me to get infected? Could the vaccine actually lead to me becoming infected with the coronavirus? Well, one thing about these vaccines is that you're not actually getting virus. That's typically how you think of vaccines, like going back to smallpox. You'd give a little bit of the virus, the body would react to it. It wouldn't make the body too sick, but the body would react to it, and then they would have antibodies. In this case, you're just giving the genetic code for a portion of the virus. As a result, you're not actually giving any virus, certainly no live virus at all in the vaccine, and you really can't get infected. We're going to see these trial results. We're going to see what happens with the FDA next week, but a lot of these are the same types of questions that are being considered by them right now.
That line on top toward the end there is the hospitalization line, that blue line, and right under it is deaths reported. So the daily deaths reported is going to go up. So we just broke an all-time record, which is horrifying and infuriating, frankly, Sanjay. That's today. But there's every reason to think that what's going to happen over the next 3 weeks isn't just awful, but I'm talking historically catastrophic. I'm talking 1918 levels of pain for the next month and a half or so until the vaccine comes into play.
I have been following that and tracking exactly what you said very closely, John, to sort of see where are we in this country as compared to what we widely consider as the worst public health disaster in the history of the world 100 years ago, or at least the last few hundred years. And we're 3 times the population that we were back then, but we also have better hospitalizations, ICUs, therapeutics, an ambulance system. And despite that, just if you look at the numbers, we are tracking just as badly as back then, which speaks to the fact that no matter how good we get scientifically in terms of these therapeutics and all the wonderful things that medicine can do, despite all that, human behavior is still sabotaging us. That is what's leading to this. And John, if you look at the proportion of deaths now compared to cases, right, it is better now than it was back in March when we were still trying to figure this thing out. Like, what exactly is this? But even despite that, because the absolute numbers are so high on a daily basis, the number of people who are becoming newly infected on a daily basis is so high, it hardly matters, just as you say, because the number of deaths, the death rate is going to be still unacceptably high. And at some point, we're going to peak. I was looking at the IHME models again last night with some modelers. The projected peak keeps moving, but sometime in January, the issue really is that we may stay there and just plateau at that unacceptably high level for a long period of time. And I think that's the real concern now. The actions we take at this point could bring that peak down more quickly. It's probably not going to avoid that peak or blunt that peak at this point because it's just too fast moving. The exponential growth is too high. And also, ambulance systems breaking, 90% of hospitals now at capacity around the country. Where do you go? When it was primarily in the Northeast, again, back in the spring, you did at least say, well, look, the rest of the country is not as affected. You could send patients out of the region. It's bad, but we do have all these sort of escape hatches. If the entire country is on fire, what is the escape hatch? It's becoming increasingly hard to find one.
We are seeing numbers that none of us believe it was possible to see with this pandemic right now.
It's never been this bad, and it's only getting worse. The U.S. setting records for new coronavirus cases, hospitalizations, and deaths Thursday. Some 14,000 people losing their lives to the virus just since Thanksgiving. Now an influential model predicting the death toll will nearly double to almost 539,000 people by April 1st. That's more people than live in Atlanta, in Sacramento, or in Kansas City, Missouri. Experts warning there is more trouble ahead.
So I think we have not yet seen the post-Thanksgiving peak, that it is likely we'll see more of a surge as we get 2 to 3 weeks past the Thanksgiving holiday.
That peak putting more pressure on already struggling hospitals and 911 systems.
What lies ahead for the next few months? It's actually our worst case scenario in terms of overwhelmed hospitals, in terms of the death count that is occurring.
Ohio's governor warning the state's hospitals are already in crisis. California, which hit another single-day high for new cases Thursday with more than 21,000, pulling the emergency brake with new restrictions tied to hospitals' ICU capacity.
The bottom line is if we don't act now, our hospital system will be overwhelmed. If we don't act now, we'll continue to see a death rate climb, more lives lost.
With hospitals in the Golden State treating a record number of COVID patients in the ICU, the new stay-at-home orders will go into effect 48 hours after a region's ICU units fall below 15% capacity. 4 out of 5 regions expected to reach that threshold quickly. Meanwhile, states are preparing to distribute thousands of doses of a coronavirus vaccine as soon as possible after the FDA signs off, which administration officials say could happen within the next couple of weeks.
We're going to get the most vulnerable and our essential workers all vaccinated within 3 or 4 months. That takes us, say, to mid-spring. That doesn't mean we're out of the woods, but it does mean we're beginning to turn the corner. Then we can more broadly get the vaccine out there.
But doctors say mitigation efforts are still essential, a message echoed by a 23-year-old in Arizona who suffered a stroke during a bout with COVID.
I thought if I get sick, if I test positive, I'm just going to have a little bit of trouble, but I'll be okay. And I was not okay. And so I would just say it's like time to start taking this more seriously than I think a lot of people have. So like wear your mask and social distance.